to ask the First Minister what the Scottish Government is doing to ensure that published NHS waiting times for treatment are accurate.
First Minister.
Published statistics are collated and quality assured by Public Health Scotland. They're published as part of the full release of national statistics each quarter. National statistics status means that the official statistics meet the highest standards of trustworthiness, of quality, of public value. The UK Statistics Authority has designated PHS stats as national statistics, therefore signifying their compliance with the Code of Practice for Statistics.
Jackie Baillie.
There are, of course, 1 in 7 Scots on waiting lists currently, and senior clinicians have warned that the waiting time statistics published on NHS Inform are both inaccurate and misleading. I wrote to the UK Statistics Authority in October last year. They agreed and asked the Scottish Government to make changes. 6 months later, and very little has changed. Clinicians are still up in arms about the stats being skewed. The Scottish Government continues to use median waiting times and mixes emergency and elective care. So can I ask the First Minister, will he now stop pulling the wool over people's eyes, rectify this misleading data, and can he tell us, did he publish the stats whilst knowing about the criticism of their flaws?
First Minister.
No, we did not. And of course, we read the letter, received the letter from the Stats Authority. And of course, I engaged with the Scottish Society of Orthopaedic Consultants. And of course, I'm sure the Cabinet Secretary for Health will continue to meet with the same organisation. It is incorrect for Jackie Baillie to suggest that changes weren't made. So she's right, of course. We received that letter in October 2022. We then worked with Public Health Scotland and NHS 24 to review and address those key points that were made. Following the recommendations from the Office of Statistic Regulations, we made a number of changes. That included, for example, highlighting both the strengths and indeed the limitations that the data showed on the website. There is also now additional links for the full release of national statistics on the PHS website. That provides further information in relation to the distribution of waiting times for patients who have completed their waits, but also those who are still waiting. And in terms of the criticism from the Scottish Committee for Orthopaedics and Trauma, Scott, the Cabinet Secretary for Health and Social Care will, of course, continue to meet with them. But can I commend them and their members and all of those working in NHS Scotland for the fact that despite significant ongoing pressure, of course, we have seen that the number of outpatients waiting longer than 2 years for a new outpatient appointment has reduced by 50% since September 2022 and by over 60% since June 2022.